Febrile neutropenia still causes morbidity and mortality in patients who end up in the hospital as a complication of chemotherapy. At the same time, most patients survive, and most patients they either get treated as an outpatient or they leave the hospital and they go on with more treatment. But what happens is the doctors then will modify the chemotherapy and reduce the dose intensity of the chemotherapy. And we know the dose intensity, that is how much chemotherapy is given over what period of time, has a dramatic impact on the cure rate. How likely patients getting the chemotherapy, early stage breast cancer is considered a curable disease, but if you don't give the chemotherapy as it was originally designed in the clinical trials, we have good evidence that the cure rates, the long-term survival, it goes down because of a higher rate of disease recurrence. So the occurrence of these events not only has immediate effects because there is a small risk of mortality, but has downstream effects by leading the clinician to modify the chemotherapy and give less effective chemotherapy, so underdosing the chemotherapy, which makes the patient feel better and they're less likely to be in the hospital. But 2 years, 5 years, 10 years later, there may be a higher risk of the disease coming back. So that's why this kind of data is very important, that we really know how frequent these problems are, what the downstream consequences are. And again, most of the randomized trials don't provide that kind of data, and we need this kind of real-world data. So I think from that standpoint, it's confirmatory, but it's confirming what we have seen before, which is the rates are much higher than what we had thought from the trials.